Okay, here we go. Okay, thank you, sir. In 3, 2, and 1. In recent years, doctors have become more aware of sleep apnea. It's a disorder associated with abnormal pauses in breathing during sleep, and there are several ways to treat it. Well, joining me now is Dr. Bill Merriweather. He's with Merriweather Dentistry, and one of his patients, Rebecca Talton. And we thank you so much for being here to kind of discuss sleep apnea, because there are some advances in treatment, I should say. But first, let's talk about, Dr. Merriweather, how can sleep apnea affect a patient's life?
Well, the most obvious way is that they're tired and fatigued, but it also, the fact that they don't get good sleep taxes the rest of their body, their heart and their lungs. So it adversely affects just about every other disease a person might be subject to.
And how is it treated?
Well, the most common way for it to be treated is with CPAP, which means a continuous positive airway pressure. And that means using a device that actually pumps air into the patient.
And actually, Rebecca Talton, you're here because you've used a CPAP.
Yes.
This is your machine actually right here?
Yes.
And how do you use it?
What happens is when I get ready to go to bed, it's already set on a pressure rating that's set by my physician. And then this right here straps around your head. And then this part, it just attaches up to your face. And it covers the nose and the mouth.
Okay.
And provides that positive pressure that's a continued pressure that goes through your nose and your mouth.
And certainly it worked for you. However, I could see it, perhaps it could be uncomfortable, would you say?
I had trouble tolerating it because I felt like I was suffocating. I had the straps stuck to my face, and then I had all the pressure coming in my nose and my mouth. So I did feel like I was suffocating, and then I ended up being unsuccessful with it.
Okay.
Because I didn't want to be compliant with it because I was just so miserable.
Right, I understand. But apparently you heard about an alternative.
I did.
That Dr. Merriweather, you certainly can tell us about.
Well, a dental alternative basically involves wearing a device that repositions the lower jaw and tongue. And by doing this, it opens the airway so that a person can breathe comfortably and effectively again.
And I understand, Rebecca, you were fitted for one.
Yes.
And you have it with you?
I do.
And how is it now? How is your sleeping now, I should ask?
I sleep all night. I have no snoring. People in my household are so much happier.
Sounds like you are happier too.
Yes, I am. I'm much more awake during the day. I have no more napping during the day. And once I go to sleep, I'm asleep and do not wake up until my alarm goes off in the morning. The sleep apnea is not waking me up, choking like it was doing before.
So what do you do with the oral appliance?
With the oral appliance, it has a top and a bottom, and you stick the top in.
As simple as that. And then a bottom? As simple as that. Wow. And that there makes a difference. Okay, thank you for showing us how that works. And Rebecca, does she have to be fitted for that?
Yes, it's custom made. Not only does it have to fit her jaws and her teeth, but it's built to position her jaw in a certain place.
So that she can sleep without sleep apnea.
Yes.
Exactly.
Well, thank you so much for sharing this with us. And certainly, Dr. Merriweather, if folks want to learn more about the oral appliance to combat sleep apnea, they can contact you.
They certainly can, or they might visit my website, merriweatherdentistry.com, or the American Academy of Dental Sleep Medicine. Those are both great resources.
Well, thank you so much. Thank you both for being here.
Thank you.
All right.
Thank you.
Certainly. We'll be back. Do stay with us.